Hi, and welcome to Kartzinel Conversations. I'm Dr. Jerry Kartzinel, a pediatrician, and I've been working with children for over 35 years now, focusing on autism. When I was in medical school in the 1980s, the rate of autism was 1 to 4 children per 10,000. And we've watched it grow to 1 in 166, 1 in 80. Now it's 1 in 32, and maybe even higher in some parts of the country. Well, it wasn't too long ago, 28, 29 years ago, when my first boy was diagnosed with autism shortly following the MMR vaccine. We lost eye contact, change in bowel habits, hyperactivity, loss of words, vocalizations, irritable, cranky, lining up things. Kind of set me on this trail of trying to figure out where this came from and do we really have the right diagnosis of autism? I mean, what is it really? Maybe we're asking the wrong questions. So today we're going to be talking about, from my point of view as a physician, what are the comorbid issues that our children face? In other words, when we say comorbid, we're talking about constipation, diarrhea, hyperactivity, sleepless nights, not going to sleep easily, recurrent infections like ear infections, lung infections, skin issues like eczema, attention deficit, hyperactivity, a whole bunch of things that they call comorbid. But in general, doctors would just blow that off and just say, that is just autism. Well, we have something more to discuss. Obviously, when you hear the word, your child has autism, well, I know exactly what you mean, not only from the children that I've had the privilege of taking care of over these decades, but as a parent and having a wife saying, hey, what's going on here? So I was initially perplexed, as I'm sure many of you are when you're faced with that. And currently, the only recommendations is, well, ABA therapy. But what about the constipation, doctor? What about the recurrent ear infections? What about, the constipation is just willful stool holding behavior, they'll tell you. Or some kids just get lots of ear infections and we can get ear tubes. And they kind of blow it all off, not really addressing, hey, some of those core issues. But as parents, we get fearful about this. We can get angry about it. Intense feelings. What do we do now? It's not philosophical, it's not political, it's not academic, but what do we actually do? And that became the driving force in my professional career. What do we know? Now, back then, we didn't have the internet. We just had our books, and we shared a lot among physicians, and we had roundtable discussions trying to figure out what is autism, and are we asking the right questions? For example, it was proposed that autism is a genetic disorder, so therefore it must be genetics, kind of like Down syndrome, and there's not much you can do about it. But despite many millions of dollars in research looking for the underpinnings of genetic causes, well, we haven't found any, and there's not that much you can do about it from a geneticist's point of view, except he'll say something doofus like, well, you're still young and you can have more babies, or this is just a normal variant of how children grow. Well, it's not a normal variant, doctor. This shouldn't have happened. We had a normal child for the first 6 months, year of life, and now we have something different. Well, then the next doctor to see would probably be the psychiatrist or the behavioral pediatrician, and they rely heavy on, behavioral disorders, and of course, then you get into your different therapies and medications for behavioral disorders. So what if we look at this and say, well, maybe this isn't a behavioral disorder, but it's a signal that something wrong. Had a child once who is in the hospital with multiple bruises over his face due to self-injurious behaviors, not because of parents, but that's what they were concerned about. Maybe this is a child protective services issue. Turned out the child had inflammatory bowel disease. The gut was just in a very painful condition, and the only way that this young child could, deal with it is just to inflict pain upon himself. It sounds counterproductive, but that's how they very often do things. In other words, the behavioral pediatrician or psychiatrist will say it's just self-injurious behavior because of autism. Well, again, we're talking about maybe this isn't just autism per se, but he's got inflammatory bowel disease. Can we look and see if he is or her in a painful condition? So I'm not saying that autism is caused by one thing. That'd be oversimplifying. It's very complex, and that's why if you know other children on the spectrum and you are taking care of a child on the spectrum, they're really different. Kind of like 31 flavors of ice cream. We call it all ice cream, but chocolate's really different than vanilla. It's really different than strawberry. And what works for one parent and really helps may not help the next parent. So there's a lot of underlying conditions that lead to autism, or at least what we call autism. So we certainly don't want to define it too narrowly. You can just say, the narrowest way to talk about it would be, well, it's just autism, and that's just it. And, you may want to think about institutionalizing when you're no longer able to take care of him or her. That doesn't sit very well as a parent, okay? So I was not willing to define my son as his father as being autistic, and that's just the way it is. Remember, he wasn't sleeping. He was having sandy diarrhea. He started self-limiting his diet down to 5 things, not sleeping. Now, I wasn't going to just say, well, that's autism. I'm going to say, hey, I wonder if there are conditions that are causing some of these behaviors, okay? So, like one time, I have to tell you, when my son was about 5 years old and we were staying at my in-laws' house, in the middle of the night, he went to the freezer and got into the ice cream, and he brought the whole tub back to his room. He proceeded not to only eat it, but fling it everywhere, in the carpet and on the walls and the curtains. It melted, and by morning the ice cream was everywhere. Every surface was covered with ice cream. Didn't make the in-laws too pleased about that, but it was a good introduction of what special needs really is. Special needs. Now, in this kind of story is kind of humorous to tell in hindsight, but as you know, when you're in it, it's not very funny. But it did represent something much bigger to me. Now, if I put on my clinical hat, take off the doctor hat, let's just think about it. He was very impulsive. He had poor sleep because he was waking up in the middle of the night. He had sensory dysregulation. He had great fun flinging cold, wet, sloppy stuff all over the floors, carpets, windows, everything. Some obsessions. He was able to typically respond to internal signals. Remember, he was 5, and 5-year-olds know better. A 2-year-old maybe, but a 5-year-old. So was this really autism or just something going on inside of his body? So that's how I started to shift my thinking. Instead of asking, how do I treat autism? I began to ask, what can I treat? What can I do to improve sleep, reduce pain, reduce inflammation? Can I address digestive issues? Can I optimize nutrition? Remember, he was very self-limited to what he was eating. He was only eating, at that time, 5 things: chocolate chip cookies, French fries, bacon, a sugary cereal, and drinking a gallon of milk every day. Maybe there was something in the diet that was causing problems. In fact, if you think about it, for many of you who have children with self-restricted, self-limited diets, if you ate just what they ate for a month, 4 months, 6 months, how would you feel? Well, that's kind of what we're dealing with our kids. How do they feel? And how are they acting out? And if we make improvements on, say, nutrition in this case, in sleep, in bowel movements, would I have a different kid? Sure, still with special needs, but his quality of life, and of course our quality of life as parents and family of 3 older brothers, would greatly improve, and that's kind of what we were after. So I begin to notice something in my clinical practice. The children didn't come in with just the diagnosis of autism, because that's what the parents say, well, he has autistic. And I would say, well, I don't know if I'd call him autistic. I'd say a child with autism. That's a little nuance in wording, but that's kind of how I prefer to do it. They actually came in with that diagnosis of autism, but they also had chronic constipation or diarrhea or recurrent ear infections or sleep disturbances, high anxiety, the food selectivity that we've been talking about, skin issues, immune dysregulation, which is a fancy way of saying that they get sick often, or they've got a lot of allergies. That's all part of the immune system. High tolerance to pain, poor nutritional status. And these aren't abstract concepts. These are physiological processes that we do have protocols in medicine that make sense. If you think about it, if the child's not sleeping well, and he has chronic abdominal pain and inflammation, has nutrient deficiencies, what do you expect their behavior to look like anyway? It's not going to be pleasant for anybody who's responsible for taking care of us. Would any of us function optimally if we had those circumstances? Not you, not me, certainly not my wife. I mean, sleep's a big thing for her. So it was a reframe. It became central to my thinking. Autism may represent, at least in part, a mismanagement of incoming stimuli to the brain. That's a different way to do it. What am I meaning there? How our body responds to our environment, both internally, not being able to potty train, for example, not knowing when we're hungry or thirsty, or not being able to stop eating. We're eating all the time. We don't get signals of fullness or satiety. So we're not responding to our internal cues. My son could walk on hot gravel in bare feet in summer, obviously not responding to the cues of pain threshold in the feet, okay? Some children don't respond to their name. They don't respond to their hunger signals. They respond very intensely to sounds or textures or other sensory issues like washing hair. Oh, my son would scream when we would wash his hair. And it's like, dude, we do this every night. I don't get water in your eyes. It's over in a flash. But it was an abnormal response to an everyday stimuli, washing his hair in the bathtub. Okay, so these kids have abnormal responses to everyday stimuli. And the more abnormal responses to everyday stimuli, the if you allow me to say, the worser they are on the autism spectrum. If I can remove many of these abnormal responses, the transitions to sleep, the transitions from a preferred activity to a less preferred activity, tantrums, then they become less and less severe on that autism spectrum. Their world opens up, they become more present, and now language means something to them. They can follow simple commands. It just makes sense. So what are those, those underlying physiological stresses? Well, sleep deprivation is certainly a huge issue for all of us, but especially our kids. Chronic inflammation or neuroinflammation in the brain, affects neurotransmitters and how they react. Pain changes behavior. We all know that. So, I mean, who doesn't get a little snippety when they have a migraine or abdominal issues or something like that? I mean, that just makes sense. It makes sense. Medically, it makes sense. I've had the conversation with high-functioning children on the autism spectrum, and they'll say, or actually teens, they'll say, don't treat my autism, don't treat me like I have something, okay? And I'll say, fine, so if you break your arm, I shouldn't fix it? Well, no, you can fix it, but you're autistic, you said, don't let me, well, I didn't mean that. Well, that's kind of my approach. I mean, if you have chronic constipation, you can have your autism, but let me fix the chronic constipation or the inflammatory bowel disease, the things that we've talked about. And they say, hey, well, that makes a lot of sense. Maybe I should look different. And I said, if you have a broken arm, how do you think your behaviors are going to be? You're not going to be very happy, are you? You'll be in a lot of pain, might even be crying. Yeah. Let me fix that. Let me give you some medicine for the pain just temporarily. Oh, that makes a lot of sense. And that's kind of my approach with this. And when you do take care of the underlying physiologic responses, well, they sleep better, they engage more, they're happier in the skin they're in, they're not these grumpy kids. Um, not because the autism disappeared, but because their body, their senses became more regulated. They're more in our world and less in their own. That stimmy world, that world of just disconnect. Very often, parents will ask me, is there something structurally wrong with their child's brain? That's a big question. Most of the time, not all, but most of the time, the children were developing normally for the first 6, 8, 9 months, year, even a year and a half. So if there was something structurally wrong with the brain, it would have shown up really soon, 2, 3, 4 months. They weren't sitting on time, they weren't rolling over, they weren't cooing, they weren't eating, they had seizures, something was off. But that's not the case in the majority of children I see. Not all, but the majority of children I see. Oh, but the doctors always seem to want to go get MRIs, or the parents went to ChatGPT and said they need to get MRIs, and they get MRIs, and remember, an MRI doesn't show you function, it just shows you structure. They got a left half, a right half, front half, back half, top, bottom. They're normal most of the time. Every now and then I get something odd, but like I say, most of the time, the brains are normal. All the parts are there, the structures are intact. Emerging research suggests there might be issues with connectivity and how regions communicate. Rather than missing pieces, they're just having something not moving as well as it should through one region to the next. There's also ongoing research in neuroinflammation, chronic activation of immune processes in the brain. But it's still an area of research, and as you guys know, because I know you guys do a lot of research, nobody's really interested. When you read research about neuroinflammation in the brain in children on the autism spectrum, it's not coming from our major institutions and medical centers. Okay, it's coming from doctors who have small sample sizes that they're able to do some research, like maybe a spinal tap or whatever, but that's very, very rare. I was so naive 25 years ago, 30 years ago, people would ask me these same questions. I'd say, oh, just wait in 10 years when the medical centers have their teeth sunk in this and the research done, we could tell you why. Well, nothing's coming out. It's very, very slow, any kind of research. So hopefully now with what's going on with Health and Human Services, we might be able to get some research grants to really look at other physiologic underpinnings going on in these children that we can correct and we can prevent. But it's not a simple answer. Inflammation can be anywhere in the body, the gut, the sinuses, digestion, joints can be inflamed, movements can be painful. So whenever you have any kind of inflammation, it always seems to impact how they process all the incoming stimuli of our world, and things can just drive them nuts, and they can have strange fears, anxieties, obsessions. It's just amazing what they can do. So we're not trying to claim certainty here. We're just trying to open up avenues of treatment that bring about increases in the quality of life of the kids. And if the autistic symptoms go away as a result of fixing some of these areas that are not functioning optimally, I'm good with that. And so are my parents. They're really good. And I've been doing this long enough now that I'm getting letters of them graduating high school, they're in college, they've got boyfriends or girlfriends, they're, of course, they're driving. They're quirky, but they're functional, as opposed to being quirky and non-functional. And that's what I'm after. So we have to widen our lens, asking the question, what can we treat? What can we treat? What do we know that's safe and effective? And bring those treatment modalities to our children who are not feeling good. We also can't ignore something that's going on, the elephant in the room. The number of children who are being diagnosed with autism has increased tremendously over the decades. Am I better now as a physician diagnosing autism than I was in the 1980s? No, it wasn't missed, as some people would pretend. Um, oh, well, we just called it mental retardation. I don't know about you, but most of these kids are really, really sharp. They really can figure things out, and they can manipulate you and me and run the household. That's not a sign of intellectual dysfunction. The old term would be mental retardation. That's not what we're talking about here. There are multiple explanations being offered. Well, we've expanded the diagnostic criteria, and I'll say yes, we have, but that doesn't alter the number of children who are not able to perform age-appropriate tasks. That has increased dramatically. Again, in school in the 50s and 60s, we didn't have classrooms of special needs kids. And if there were special schools for some of these kids, they were for the blind, for the deaf, maybe for the slow function. But our kids, there's a lot more to it than just being, if you will, slow in function, which the majority are. You see these kids, they are not slow in function. They know exactly what they want, how to get it, and they are fast. Increased awareness. You mean if I wasn't aware, my son wouldn't have autism, or your child wouldn't have autism, but because you're more aware now, they do? That doesn't hold water to me. That's not going to work. People want the diagnosis of autism so they have access to services. Again, so my wife would say, if we didn't want access to services, does that mean that my son doesn't have autism? The only reason he has it is because we want access to services? Silly kind of statements made by professionals. And you know the frustration with that. Some people say there's greater survival of medically complex infants. The vast majority of the children that I see were not medically complex infants. They had a normal pregnancy, a normal delivery, and a normal first year of life, 8 months of life, 6 months of life. There was a period of normal. Not all of them. Now, some of them, there could have been some things happening that shouldn't have happened, but the vast majority, no, that wouldn't be it. Possible environmental or metabolic contributors. Now, that is a possibility. There's a lot of contaminants in our environment. We don't need to go into all of them that are out there, at least not in this survey, this discussion. Obviously, the elephant in the room is the huge expansion of the vaccination program. Now, a lot of parents will tell me it was the vaccines that did this. Some of the parents will tell me they weren't really aware of any particular event or vaccination that caused anything, and others will tell me we had a 105-degree temperature following the vaccines. The kid was screaming for 48 hours, and they had their first seizure 3 days later. Okay, that doesn't sound like it's very boding well for the vaccine that they had received. But the honest answer is I'm sure it's multifactorial, because I do have children in my clinic who have the diagnosis of autism that were never vaccinated. So there is other things that are probably contributing to this. But regardless of why the autism has increased in diagnoses, we know that the families affected have increased, and the families need practical guidance, and that's what this series is all about, is helping you navigate the waters of this autism and finding those particular patterns, those particular issues that your child has, what we can do, because again, they're going to be different than the next child. So everyone is pretty darn unique. Debating the etiology or the source is important, but I think helping the child sleep through the night is urgent, okay? Reducing chronic constipation is urgent. Addressing nutritional deficiencies is urgent. I'll let smarter people figure out where this is all coming from and laying down the groundwork to make the changes in our world. We can pursue the scientific understanding, but I'm pursuing the clinical optimization, optimizing that child's quality of life, improving those things that are kind of apparent. And if you think about it, hey, the apparent things are he's not sleeping, or he's stimming, or he's doing something. Let's fix that. So here at Kartzinel Conversations, here's what we'll be about. Well, we won't be arguing about politics, and we aren't going to be oversimplifying complex science. We get to complex science issues later on. I'll make it so you understand. I'll make you an expert on that. We're definitely not going to make absolute claims, but what we're going to do is be something much more practical. We'll examine the medical systems together that commonly affect the child with autism. You know, things like diet, digestion, constipation, sleep, immune regulation, nutrition, inflammation. And we'll be asking, what is treatable? What is measurable? What is reasonable? What is supported? What's emerging? A lot of things are emerging out there, and everybody's out there waving their arms saying, you have to try this, you have to try that. And you'll always read about people talking about this cured my kid, and I don't know if that's created by bots or people in another country. What's speculative, and more importantly, how can families think clearly and work productively with their physicians? That's what it's all about. If you're a parent listening to this, or somebody who has a special needs child that you're involved with, I want you to hear something clearly. You're not crazy for wondering if something more is going on. I know you were always asking questions, or you wouldn't even be listening to these conversations. And there are parents like that. Oh, well, they've got the diagnosis, and there's nothing further that we can do, and we're not interested in what you have. Okay, I'm good with that. I'm going to work with the families who are digging into the underlying causes. You're not irresponsible for wanting improvements in your child's life, improving your child's physiology. Autism is lifelong, but a lot of the symptoms are reversible, and if you can reverse enough of them, the outcomes are pretty darn good, pretty exciting to watch. But suffering from untreated medical issues is not necessary. So in our next episode, we're going to be diving into the medical issues that commonly accompany autism and why they're so often overlooked. Thank you for being here on this edition of Kartzinel Conversations.